Joining me now, the congressman responsible for making sure that this bill had enough votes to pass, the House Majority Whip, Steve Scalise. Good to see you today, sir. Welcome.
Good to be with you, Martha.
Congratulations, because this is something that you were working on, and you achieved it today. And we saw Kevin McCarthy stand up and say, you know, this is the guy who never gave up on this process. So I think everybody would like you to take us behind the scenes and show us a little bit of how this sausage was made. What was it like?
Well, you know, it was a lot of work, and look, all of our members in the Republican conference have been working really hard to try to find a way to get to yes. We still had more work to do a few weeks ago. You know, we would have liked to see the bill pass sooner, but the most important thing was getting it right. And fulfilling this promise and starting the process of repealing and replacing Obamacare so that we can lower premiums and put families back in charge of their health care. So, you know, we worked very closely with President Trump. He was engaged from the very beginning. Vice President Pence was very hands-on. So our teams worked well together. But ultimately, every change we made to the bill over the last few weeks, we're focused on lowering premiums more and bringing more members on board that weren't there. And so we had a lot of cooperation. But look, it was difficult. But yeah. I always said from the beginning, failure is not an option. This is too important to the people that elected us, that want relief from Obamacare, that we had to get this done. And so I'm glad we were able to pass it out of the House. It now goes to the Senate. There's more work to do, but I really feel good about where we are in our ability to actually get this on President Trump's desk.
So tell me about that, because the House did its job on this bill, but now there's a long, arduous process ahead, and we know that it's going to look very different when it gets over to the Senate side. Do you think it will pass, and what kind of changes do you expect to see?
Well, you know, for all the people that said it couldn't pass the House, I always knew that we had a path to get it out of the House. I knew it wouldn't be easy, but I also knew that it was going to take a lot of work, and that's why we're here. That's why we ran. I've already talked to John Cornyn, the Senate Majority Whip, and he's already working on what they need to do in the Senate to put a similar coalition together to pass the bill. They can only lose 2 senators over there, and that means Vice President Pence would break the tie. But they know, look, we're going to, you know,
let me just jump in, because I want to give you some news that we just got, because word is just breaking that the Senate says that they will basically come up with their own legislation and that they will incorporate parts of yours. What do you say about that?
Yeah, I know we've been working with them every step of the way. They've been following what we've been doing and the changes we made. We actually have to check with the Senate, because a lot of the limitations of this budget reconciliation process that allows you to pass this bill with 51 votes in the Senate means you have to work with the Senate. So if they can make more improvements to the bill, I'm all for that. I think that would continue to improve this process, and you know, and then we'll see what they change, and if it's better, we can take those changes. If not, we'll go to a conference committee. But the ultimate goal is to get a bill on the president's desk that lowers premiums, that puts patients back in charge of their health care decisions by repealing and replacing this broken law.
Before I let you go, how important was it that the GOP was getting so much criticism for having the House, the Senate, and the White House and not being able to get anything done? Did that end up helping you guys because you were sort of getting hammered for that?
Well, you know, we were focused from the beginning on making sure that we did get it done, because like you said, when you have the House and Senate and White House, failure's not an option. You've got to get it done. You've got to follow through. And I think you saw that focus all the way through. I mean, you know, there were times when people could have given up on the process, and we never did, because we knew we had to get this done for a lot of reasons. But the main one is because we promised people we'd give them relief from Obamacare. And so you saw that coalescing. You saw members from all different factions within our conference come together, and it was a really healthy process. You know, it took time, but look, it took over a year before Obamacare got on President Obama's desk. In just a few weeks, we were able to get this moved through the House, and now it brings it to the next step. But let's provide relief for those families.
Lots of steps to go. So we will see. Steve Scalise, thank you very much. Good to see you today, sir.
Good being with you, Martha.